Hi, I'm Dr. Callanan. In this video, I'm going to explain to you what insulin resistance is and show you some blood work that resembles what your body should be doing when you consume carbohydrate. For those of you who don't know me, my name is Dr. Callanan. I'm a naturopathic and functional medicine doctor, and I help individuals get to the root cause of their resistant weight loss and low energy. And one of the common things that I see in my practice is insulin resistance. But what is it and what do we do about it? As you can see here, this individual is consuming an apple. Any foods, regardless if they are healthy, like fruits and vegetables, or unhealthy, like cake and cookies, if they consume carbohydrates, your body is going to digest that and break it down into glucose or sugar. And as you can see here in the photo, the red squares resemble glucose or sugar. So you eat carbohydrates, you have a rise in your blood sugar. This is normal. This is what we would expect to happen. After there's sugar available in the bloodstream, that's going to send a signal to your pancreas to start making insulin. And insulin is depicted here as the key. And the role of insulin is to help get the sugar from the bloodstream into your cells. Essentially, think of a lock and key or a door on the outside of the cells. Insulin needs to open it so that the sugar can get in. This is really important. You want your cells to be getting glucose so that your muscles can work, your brain can work, so that you can feel good, you have good energy. And of course, by getting the glucose into the cells, it's going to reduce your blood sugar. So your overall risk of things like prediabetes and type 2 diabetes goes down when your blood sugar is under control. You can think of insulin resistance as an issue with the lock and key. That lock becomes jammed. So now what happens is your body is still making insulin, but it can't open the door to the cell. So there's still sugar available in the bloodstream. So your pancreas is still getting the signal to make more and more and more insulin. Now, the problem with higher amounts of insulin is that it causes the symptoms that you're experiencing. Higher amounts of insulin for males and females can change your hormones. And insulin is a fat storage hormone. It says store. So if you are constantly feeling tired, it could be that your cells are not getting the glucose that it needs. The other thing is your body always wants to defend itself. Prediabetes, diabetes, that's where we start to see damage to organs. Damages your kidneys, your eyes, your nerves. Your body is trying to protect you from this. Higher amounts of insulin says to the body, okay, the sugar's not going into the cells. Where else can we put it? And with the support of the higher amounts of insulin, your body is going to take the glucose from your blood sugar and put it away in storage. It's like, okay, it's not getting into the cells. What's plan B? Plan B is to take that glucose from the bloodstream, put it away in storage. We can see fatty liver develop. We can start to see higher amounts of triglycerides. And of course, we can store energy. We can store glucose as body fat. This is a really big problem because there's energy available, but your cells cannot use it. You're always going into storage. Now, the problem a lot of individuals run into is when they're fasting, as insulin resistance progresses and progresses, they're going to have higher amounts of insulin, even though they're fasting, they're not eating. And that higher amounts of insulin says, okay, take the sugar, put it away in storage, put it away in storage. That's why you can feel so fatigued and your cells are essentially starving for energy. So you have that higher appetite or food cravings, or food is always on the brain. Now we can test for this. We can test a fasting level of glucose. We can test a fasting level of insulin to see if insulin resistance is present for an individual and to what significance. Now, if an individual has an elevated BMI, or they're clearly storing more weight gain around the midsection, or they're struggling with their weight, or we see the blood sugar is going up, they do have insulin resistance. We know that. The research is very strong, that association. If you're pre-diabetic, type 2 diabetes, you've had insulin resistance for a period of time, because remember, insulin is going to rise in an effort to control the blood sugar. By the time your blood sugar actually goes up, your hemoglobin A1C goes up, you've had insulin resistance for a significant amount of time. And we want to look at what your starting point is on blood work to establish where are you starting from. Technically, you don't need the blood work at this point in time, but I like to run it in my practice because I like to see changes over time. You have to resolve the insulin resistance first in order to see the changes in terms of the number on the scale. So many individuals get frustrated when they're not seeing changes on the scale if they're solely focused on their weight. But it's nice to be able to repeat the blood work in 3 months' time to see if the insulin resistance is getting better, to provide that reassurance to somebody like, hey, what you're doing is working. Are you willing to continue it? for another 3 months or so. Let's move on to what a normal insulin curve should look like here. So these are normal results. So this test is called a 2-hour oral glucose insulin challenge test. Because remember, we want to know about the glucose or the sugar, but also how much insulin is your body having to produce in order to control your blood sugar. You could have normal blood sugar, but you're producing 2-3 times the amount of insulin just to keep it that way. And that's not ideal either, because you're going to get the symptoms associated with the higher amounts of insulin, changes to the hormones. You can see hair loss, you can see acne, you can see resistant weight loss. So it's important to test both. So in this test, what you do is the individual goes into the lab and they are fasting. They haven't consumed any food, anything that could raise their blood sugar, only water. So we test what is your sugar when you're fasting and what is your insulin when you're fasting. They should be low, right? There's no energy from your foods. They should be low. Then what we say is, okay, we need you to consume a glucose drink. And this is about 75 grams of sugar, and you consume it all at once. And then what we do is we retest the blood work at half an hour, 1 hour, and 2 hours. What you can see here is the insulin goes up in response to the glucose going up, and then the insulin helps to bring the glucose down. This graph is actually really great. This individual is pretty close to those ideal reference ranges. Her overall curve is a little bit shifted, but it's not the end of the world, because the insulin does come back down, and the area under the curve, or the amount of exposure that they're getting to insulin, is really close to the ideal. I'll see individuals in my practice where their fasting is fine, their glucose is fine, or maybe it's slightly elevated, but then at the half an hour, 1 hour, and 2 hour mark, their insulin is still going up. And remember, insulin is a storage hormone. It says store energy, store body fat. So if your insulin goes up and up and up and up, the amount of time that it's going to take for your insulin levels to fall back down is quite significant. And that means that you cannot get into this quote unquote fat burning, because you can't until the insulin levels comes down. So the amount of time that you're exposed to that insulin is much greater. Now, you can do this test. I think it's a wonderful test. Obviously, it's a 2-hour time commitment for you to go to the lab. You have to drink the drink. It's multiple blood draws. So sometimes I'll run this on individuals. I like to see it. If they're interested in seeing it, great. But really, if there's an elevated BMI, significant weight gain around the midsection, we're seeing the blood sugar go up, hemoglobin A1C go up, or the fasting insulin or the fasting glucose is higher, we can get a good idea of insulin resistance. But I hope that was helpful for you. If you have any additional questions or concerns, please let me know. And as always, if you need support with your blood sugar, if you want to talk about strategies to help improve this, you can work with me one-on-one. The metabolic reset program that I created is designed to support individuals in this position, whether or not you have prediabetes, type 2 diabetes, you're on a medication, you're not, or you're just looking to improve your overall hormone health, change your body composition, get into the best energy that you've ever felt in your entire life. That program may be something to consider. I do have my staff on hand. You do need to have an application call. It is a significant time investment that we spend with individuals that go through this program. You're also investing your time and energy in the program. So we do want to make sure that it's a right fit for us, but also for you, so that we can work together. And really, that program is designed for individuals who have at least 20 pounds to lose. There are some exceptions and modifications that we can make, but we really want to make sure that you're a good fit and we're a good fit for you. So always set up that application call first. You can't join without that. And if it's a good fit, great. And if not, we may be able to recommend some alternative avenues that we can support you with. I hope that was helpful, and we'll see you in the next video.